I am Dr. Hemant. I'm an orthopedic surgeon working in Maringo Asia Hospital. I'm working as chairman in Orthopedics. Today I will tell you about the recent advances in the joint replacement surgery. The most recent advancement is not an implant. Number one, we have a better pain controlling techniques. Everyone thinks if there is a fantastic implant, pain will be less. That is wrong. So we have to educate the patient. There is some pain, but we have newer techniques. We give injection in the back, we give blocks, we give medicine around the knee when we are doing a knee replacement surgery. Yes, robot is the latest technical development. Now, patients who are undergoing a hip replacement surgery, I've seen many people, especially ladies, they are very unhappy after the hip replacement if their legs are not equal. Now, equality in the leg lengths will come either from an experienced surgeon or from using the newer techniques such as robotic technique. Now, in the robot, we do your CT scan before the surgery and we can actually be 100% sure that your leg length difference can be as less as 1 millimeter, 2 millimeter, like 1 hair thickness or 2 hair thickness. Secondly, the stability of a hip is fantastic after the robotic surgery, because even before I have performed your surgery, in the robot on the computer, I can move your leg in different directions and make sure there is no dislocation. So patients are generally happier and the implant that we place is 100% perfect, like whatever book describes us. Secondly, every patient has a different demand. I still remember there was a guy who was a boxer and he had bad hip in the coronavirus. So he said, I want to continue to kick high, even if he doesn't want to continue boxing. So in the robotic surgery, I made him kick so high that I knew from where the hip will get dislocated. So I could change the angle of the implant accordingly. Thank you very much.